Hello everyone, I am Dr. Said Insha Saifi from the Department of Anatomy GMC Srinagar. In our osteology class today, we are going to discuss about the thigh bone or the femur. The femur is the longest and the strongest bone of the human body. It is a typical long bone. It has got an upper end, a shaft, and an expanded lower end. For side determination of the femur, we have to see the upper end. The upper end bears a rounded head, whereas the lower end is widely expanded. The head is directed medially and the cylindrical shaft is convex forwards. The posterior surface of the shaft has a roughened ridge called as linea aspera. It is having two lips, medial lip and lateral lip on the posterior surface. So this is the femur of the left side. For anatomical position, the head is to be directed medially upwards and slightly forwards, whereas the shaft is directed obliquely downwards and medially, so that the lower surfaces of the two condyles of femur lie in the same horizontal plane. Now the upper end. The upper end of the femur includes the rounded head. It has the neck, greater trochanter and the lesser trochanter. This is the lesser trochanter. This is the greater trochanter. This is the head and this is the neck. The head is a rounded structure. It is approximately more than 1/2 of a sphere. It has got a rough pit just behind and below the center of the circle. This gives attachment to the ligamentum teres, and this roughened pit is called as fovea capitis. This one. Rest of the head, it articulates with the acetabulum of the hip bone to form the hip joint, ball and socket type of the hip joint. Now the neck. Neck connects the head with the shaft and is approximately 3.5 to 4.5 centimeters long. The neck has got two borders, upper border and the lower border. It has got two surfaces, anterior surface, this is the anterior surface of the neck, and this is the posterior surface of the neck. The anterior surface is flat, while as the posterior surface is convex from above downwards and concave from side to side. The neck makes an angle with the shaft called as neck shaft angle, which is approximately 125 degree in males, and it is somewhat smaller in females due to their wider pelvis. This is about the neck, which connects the head of the femur with the shaft. Now the greater trochanter. This is the greater trochanter. Lateral aspect of the femur continues up as greater trochanter. It is the lateral aspect of the femur. It continues up as the greater trochanter. It has one upper border and it has got three surfaces. It has got the anterior surface, it has got the lateral surface, it has got the anterior surface, it has got the lateral surface, and it has got the medial surface. The upper border of the greater trochanter, it is posterior part, it is interned. This is interned and is called the apex, and it gives attachment to the piriformis muscle. This upper border is posteriorly interned and is called the apex. This is the medial surface, this is the anterior surface, and this is the lateral surface. Anterior surface of the greater trochanter, it is divided into the lateral and the medial parts or areas. Lateral area has a ridge for the attachment of the gluteus minimus. Lateral, it has a ridge for the attachment of the gluteus minimus. Medial area is related to the bursa, and lateral, this is the medial area, it is related to the bursa. Under cover of the gluteus minimus, it is called the trochanteric bursa. This is about the anterior surface. Medial surface of the greater trochanter is divided into the upper part and the lower part. Lower part is marked by a depression for the obturator extensor muscle, or it is externus muscle, and it is also called the trochanteric fossa. Upper part is marked by an impression for the insertion of the obturator internus, superior gemellus muscle, and the inferior gemellus muscles. This is about the greater trochanter. Now the medial surface of the greater. Now the lateral surface. As this is the medial side, this is the lateral surface of the greater trochanter. It has a ridge. Greater trochanter has a ridge which runs downwards and forwards. The ridge is meant for the attachment of gluteus medius. Area anterior to the ridge is covered by gluteus medius. A bursa between this muscle and the area is called the trochanteric bursa of gluteus medius. This is the ridge. Area posterior to the ridge is related to the another bursa. The bursa is named as the bursa of gluteus maximus. Now coming to the lesser trochanter. This is the lesser trochanter. It is a conical projection directed medially. It has an apex for the attachment of psoas major muscle, and iliac is attached to its front. Iliac is attached to its front. This is the lesser trochanter. Now the intertrochanteric line. What is the intertrochanteric line? Intertrochanteric line marks the junction of the neck and the shaft anteriorly. It continues downwards below the lesser trochanter and on the posterior surface posterior aspect of the femur as spiral line. This is the posterior aspect of the femur. This is the anterior trochanteric. It is the intertrochanteric line. It extends from the. It marks the junction of the neck and the shaft anteriorly. It continues downwards below the lesser trochanter and on the posterior aspect of the femur as the spiral line. Following structures are attached to it. It gives attachment to the capsule of the hip joint, iliofemoral ligament, vastus lateralis to its upper end, and vastus medialis to its lower end. Now, similarly, on the posterior side or the posterior aspect of the upper end of the femur, we have got the intertrochanteric crest. It marks the junction of the neck with the shaft posteriorly. It connects the greater trochanter to the lesser trochanter. It has a rounded tubercle above the middle of it. This is called as the quadrate tubercle, and it gives attachment to the quadratus femoris muscle. This is the crest. This is the tubercle, quadrate tubercle. This is the lesser trochanter. This is the intertrochanteric crest. This is the anteriorly. This is the intertrochanteric line, which continues below the lesser trochanter as the spiral line. Shaft. It is the cylindrical, convex forwards and narrowest in the middle. Cylindrical in shape, convex forwards and narrowest in the middle. Here in the middle. The middle 1/3 of the shaft has 3 borders and 3 surfaces. The middle 1/3 of the shaft has 3 borders and 3 surfaces. It has a medial border, it has a lateral border, and it has a posterior border. Posterior border is most prominent. It is called as linea aspera. It has medial and lateral lips. The surfaces include anterior surface, medial surface, and the lateral surface. Now, upper 1/3 of shaft. The medial lip of the linea aspera continues upwards as spiral line. This one. It continues upwards, the medial lip of linea aspera. This is the medial lip of the linea aspera. It continues upwards as spiral line. The lateral lip of the linea aspera continues upwards there as the gluteal tuberosity. The spiral line and the gluteal tuberosity diverge from each other to enclose a triangular posterior surface. This is the triangular posterior surface. This is the spiral line. It extends from the medial lip of the linea aspera. This is the lateral lip of the linea aspera, and it continues as the gluteal tuberosity. And these two diverge to enclose a triangular posterior surface. Upper 1/3 of the shaft therefore has got 4 borders and 4 surfaces. The borders are medial border. This is the medial border. This is the lateral border. This is the spiral line. This one is the spiral line, and gluteal tuberosity. Now surfaces. Surfaces again: anterior surface, medial surface, lateral surface, and posterior surface. Coming to the lower 1/3. The lower 1/3 of shaft as in upper end. Here the medial lip of the linea aspera, this is the medial lip of the linea aspera. It continues downwards as medial supracondylar line, and similarly the lateral lip of the linea aspera continues downwards as the lateral supracondylar line. These medial and lateral supracondylar lines diverge from each other to enclose an additional triangular surface called as popliteal surface. This is the popliteal surface. Lower 1/3 of shaft therefore has got 4 borders and 4 surfaces as in the upper 1/3 of the shaft. The borders are medial border. This is the medial border. This is the medial border. This is the lateral border. This is the medial supracondylar line, and this is the lateral supracondylar line. Lower end of the shaft. Similarly, surfaces are anterior surface, medial surface, lateral surface, and popliteal or the posterior surface. This is the lower 1/3 of the shaft. Now coming to the lower end of the femur. The lower end includes the 2 condyles, medial and the lateral condyles, and a deep space in between the 2 condyles. And the deep space, this is the deep space. It is called as the intercondylar fossa or notch, and articular surfaces. It has got 2 articular surfaces, that is the patellar and the tibial. Patellar and the tibial articular surfaces. Medial epicondyle has got 5 surfaces: medial surface, lateral surface, anterior surface, posterior surface, and the inferior surface. Medial surface. It is most prominent point is medial epicondyle for medial collateral ligament. This is the medial epicondyle, medial surface of the medial epicondyle. Above and behind the medial epicondyle is adductor tubercle. Here, this is the adductor tubercle. Lateral surface forms the medial boundary of the intercondylar fossa. It forms the medial boundary of the intercondylar fossa, that is its lateral surface. Anterior surface forms a part of patellar articular surface, and posterior surface articulates with the tibia during full flexion of the knee joint, and inferior surface articulates with the medial condyle of tibia during extension of the knee. Similarly, lateral epicondyle, it also presents with 5 surfaces. Lateral surface, it has got lateral surface, medial surface, anterior surface, posterior surface, and inferior surface. This is the lateral condyle. An elevation on this surface is called the lateral epicondyle, and this is meant for the attachment of fibular collateral ligament of the knee joint. There is a groove present below and behind the lateral epicondyle. It gives attachment to the popliteus in its anterior part. Medial surface forms the lateral boundary of the intercondylar fossa. Anterior surface forms patellar articular surface. Posterior surface articulates. Posterior surface. This is the posterior surface. It articulates with the lateral tibial condyle during